Let's break down the marionette line. The marionette line is a line that goes from the oral commissure, the corner of the mouth, and extends all the way down to the jawline. And it's this fold that creates a little bit of a shadow, and it's a sign of aging. I want to walk you through why this happens, what are some treatment options that can help soften the appearance of this, and most importantly, who wouldn't be a good candidate for these treatments. As we age, we begin to experience all of these changes. We have the descent and deflation of our fat pads. Remember, in our younger years, our face is an inverted triangle. Everything is lifted, the fat pads are nice and lifted and sitting upright. But as we age, those fat pads begin to descend and deflate. So that inverted triangle now becomes an upright triangle because everything is descending. So this is our youthful face, the triangle of youth, and then it becomes bottom heavy. So everything is falling downward, collecting in our jawline, and that's why our jawline area gets the biggest beating when it comes to our aging changes. We start to experience what's called jowling, which is this deposit of fat or tissue that hangs out right lateral to the marionette lines, and this downward pressure of the fat pads, our bone loss, all of this is contributing to the appearance of these marionette lines, which is that fold right medial to the jowl. It can be genetic, so mom, dad, if they have harsh marionette lines, you may experience the same signs of aging as you age. But there are some treatment options for the marionette lines, so let's walk through those now. Option number one, I like to combine filler and tox. So let's talk about treatments as far as levels. Now, I think there's about maybe 3 to 4 treatment options for this area. Number one, you can tox the depressor anguli oris. Now, does this give a dramatic result or dramatic transformation? No, but it's going to help take some pressure. Remember that DAO or depressor anguli oris is the muscle that pulls down the corners of the mouth. So by alleviating or releasing this function, you get a little upward turn of the oral commissure and it kind of softens the appearance of it. I'm not saying it's dramatic, but I think that in combination with a little bit of filler can be a great option for patients. I like to go in with a 25 gauge by 1.5 inch cannula and place a little bit of filler and perform a little bit of subcision in this area. Now, with that being said, if a patient has really dense tissue in this area, for example, if they have really meaty jowls or really heavy dense jowls, I always tell them, because over medial to that dense jowl is going to be that marionette line, right? So they have this dense jowl and medial to that marionette line, and then it falls into the chin. I always tell patients with a very dense jowl that I can only soften this marionette line ever so slightly. It's not going to be anything dramatic because if you think about it, when we are, as injectors, when we are injecting filler in the marionette lines, it's all smoke and mirrors, right? We're not fixing any problem. We're just softening the appearance of the shadow and disguising the marionette line by projecting it out ever so slightly. But if I were to completely resolve the marionette line, that would mean that I projected it out to the level of the jowl. And oftentimes with that meaty jowl, that would be quite a bit of projection, which in turn would make them just look bulky in this area. Yes, they don't have a marionette line anymore, but now they look square, they look heavy, it looks dense, and it doesn't look natural. So for a patient that has a very heavy jowl, I always set the expectation. I can soften it ever so slightly, and I explain to them, patients are smart, I explain to them that in order to completely correct the marionette line, I would have to project it out to the level of the jowl. That's not going to look good. So my goal is just to soften the appearance. I can't tell you how many times I use the word soften. Soften the appearance of it, but it's not going to get rid of it completely at all. So I always explain this to patients with a dense jowl. Now, if they have mild jowling, a little bit of a marionette line, and some texture irregularities or some laxity in that area, that's my go-to patient that I could truly almost completely resolve the marionette line with filler. My go-to filler is Revanesse Versa or Evolysse Form. Those two I think lay so beautifully. It integrates so nicely. It lays like this beautiful blanket of filler in the marionette lines and integrates so nicely with the chin, creating a soft or softening that chin shadow. Those two products by far are completely unmatched when it comes to softening the marionette lines. The third treatment is PDO threads. Now, this is a temporary quote unquote lift. It's when you inject or you place absorbable sutures that have little barbs on them and they help anchor up. Because the reality is, let's think about what it is that they need. They need pullback, right? That's what's causing the marionette line is that downward pressure. So by placing threads, you can help anchor back that tissue temporarily. Now, it's not my favorite treatment because it's short-lived and I'm just not the biggest fan of threads, just in my opinion. I know that's an unpopular belief, but that's just my opinion. I prefer placing a little bit of filler, performing a little bit of tox, doing a little Nefertiti lift with tox, and then the DAOs and the mentalis and cleaning that up with tox and filler. And then if a patient has severe laxity, severe jowling, they truly can't really be softened with a little bit of filler, then a facelift is by far the number one home run treatment in my opinion. So I always have a discussion with my patients. Are they over the age of 50 and are they up for discussions of a facelift? If yes, that's going to be their home run treatment for sure. So I'll send them for a surgical evaluation. If they're in the place where they're like, you know what, I'm not ready for a facelift, I don't want it, I'm not there yet, then we perform a little bit of filler, a little bit of tox, and see if we can soften the appearance of it. But setting those expectations and just humanizing the experience with your patients, just talking to them, is what's going to make this treatment for you and for them go seamlessly. So let's walk through how I actually treat the marionette lines. So when I'm treating the marionette lines, I always like to start off with a little bit of subcision. I always use a little bolus of lidocaine with epi and bicarb just at the pilot hole, and then I use a 23 gauge port needle to create my entrance hole, and then I slide my 25 by 1.5 inch cannula into the porthole, and I work my way up to the oral commissure. As you're introducing that cannula, you're going to run into some fibers that I always say you have to knock on the door and then allow that fiber will open the door and let you in. Knock on the door. Don't ever forcibly put your cannula through. That's how you cause the hematoma and trauma. It's not needed. Just tap on the door and those fibers will move out of your way. So I like to work my way up to the oral commissure and perform a little bit of subcision, and then I place retrograde threads. I'm always painting this area. Now, one tip is to always mark your patients while they're sitting in an upright position. So I always mark them out when they're sitting upright because we want gravity to play a role. Sometimes I'll even have them leaning forward just so you could see that pulling pressure of the jowl, so you could really mark out where you want to inject the product. So I perform retrograde threads, just going back and forth. You will never see me lay one big thread of product. I'm going back up, laying a nice thread, moving the direction of my cannula, laying a nice thread, and I'm just painting the area and subcising at the same time. I think it's incredibly, incredibly important to just take your time. But a 25 by 1.5 inch cannula is my go-to. And then I like to follow it up with a little bit of DAO tox if they need to, a little bit in the mentalis, and then a Nefertiti lift if they can benefit from it. But using small amount of product, honestly, I usually, typically with Form or with Versa, I'll use a 1.5 syringe and then it lays so beautifully. Sometimes if you have a little bit in that pre-jowl sulcus, I'll reorient the cannula using that same porthole and come downward across the mandible to the chin and then soften the appearance of that pre-jowl sulcus. So that way you have a smooth marionette line chin shadow region and then all of it looks cohesive from the chin to the jowl. You can see in all of these before and after transformations how it just softens the appearance of your perioral region when you inject just a little bit of filler. It really softens it. She goes from frowning to not frowning. It really softens the appearance of this area. A little bit goes a long way. Do not add too much bulk in this area. It'll really take the patient from soft looking to kind of thick and dense. So be very, very careful with how much product you're injecting, but I absolutely love these transformations. And oftentimes this treatment lasts about 9 to 12 months. I always tell patients, if we inject your Marionette lines in January, oftentimes I'll see patients come back right before the holidays for a little touch up or a little add-on fine tuning, but typically they can get a full year out of it. But because it's such a mobile area, being the perioral region, sometimes I lean towards telling them that they'll get a full 9 months out of it. If you're loving these videos, please help me get to 1,000 subscribers by the end of the year. That's my goal. I really love recording these videos and educating on my experience, my techniques, everything. I don't gatekeep, I'm an open book. So I love it when you guys comment and ask me questions and give me feedback. So please subscribe if you're loving these videos. Help me get to 1,000 subscribers by the end of 2025.